Good day, everyone. My name is Feyikemi, and it's a great honor to be here today. I'll be handling the first reading of this book, and by doing this, I'll be reading Chapter 3, titled COVID-19 Preventive Rules and Associated Recklessness. When the coronavirus began to expand the width of its venom across the length and breadth of national societies, the World Health Organization and other social health groups did their bidding by monitoring people to follow precautionary measures to prevent the spreads. Social distancing rules, hand washing with soap and water, wearing a face mask, and stay-at-home orders were the commonest of tasks expected by people in every society. These preventive admonitions became the best possible necessity, given that curative measures were not in place. The primary essence of social distancing, like hand washing and stay-at-home orders, was to help prevent a community and public or global health crisis. Unfortunately, the objective never saw the light of day, as the virus bloated beyond the scope of an epidemic to become a pandemic. And this had occurred as a result of reckless behaviors. While COVID-19 was struggling to gain momentum at the start of 2020, a lot of people around the world had helped its course by ignoring instructions from health experts, further by going about their daily lives unconcerned. People underrated the potency of the virus' prevalent virulence, taking it might never fly out of Wuhan. Along with other people kept holding and attending social events, shaking hands, hugging, sharing pecs, and carrying out all sorts of social duties with the harmless thought that it was business as usual. But these everyday cautious lifestyles at a time when the disease was spreading fast resulted in a bane of recklessness that amounted to viral escalations and unwarranted fatalities. Even when COVID-19 had crossed borders, sending cold chills of panic attack across global cities, there was still a good number of individuals with contrasting opinions and defaulting actions regarding the measures established to prevent the spread. Some never believed in the existence of a lethal virus sweeping across the globe. Others expressed consensus defiance against following the rules. One set of people considered the virus as a harmful trifle, like the Brazilian president, Jair Bolsonaro, who termed it a little cold. However, it must be pointed out that the critical indicator of the spread of COVID-19 was a result of reckless audacity from different societal quarters. Individuals who did not follow the laid down orders were liable to contract the disease and spread it more to other people, a process that led to the domino effect of the virus. Aged people and those with underlying ailments were the most susceptible, and as the indication showed, these sets of people were the most affected by the virus. As pointed out, the disease became a full-blown pandemic through reckless actions of perhaps unsuspecting super spreaders. And all of these, nothing had exposed the fragility of humanity's reckless behaviors like the COVID-19 pandemic. As one commentator had observed, when Italy witnessed its first case of coronavirus, physical distancing was not one of the measures required by the government. Consequently, the population continued with physical interactions, which led to widespread community transmission of the virus. Like Italy, the city of New York in America was bundled up by the virus as a result of non-compliance to preventive measures. While the cities across the world had restricted movement and closed up economic activities, people in New York were still out and about, engaging in economic and social activities until when the spread exponentially and brought the cities to its knees, resulting in innumerable loss of lives. It was also reported a spike in number of cases in countries like Spain, India, Brazil, and Russia, were a result of people's negligence in wearing face masks. However, the United States, followed by the United Kingdom, were considered the epicenter of non-compliance regarding the preventive measures of the coronavirus. The appearance and effect of the COVID-19 virus into social lives brought to the fore a whole lot of dynamic interplay in humanity's quest to survive. Perspective matters in observing the role it played in keeping the world at a standstill. The same can be said about the efforts put in to prevent the scourge from escalating beyond bound. The roles played by experts like those in the health sector, those in competent governmental institutions, philanthropists, and community service providers must be commended. But for these humanists and the host of others not mentioned here, humanity perhaps might have had it to the brink of extinction, given the recklessness displayed by the host of other people. Recklessness and audacious forms made more of the morning's headlines, especially those expressed by political leaders and role models in societies. Non-compliance, contrasting the preventive strides of the virus, also made the rounds in many societies become the primary indicators in assisting the spread of the virus. A lot of people do not follow the simple rules of regularly washing their hands. Others flouted social distancing rules as well as the stay-at-home order, and more resisted wearing of face masks. These points reflect reckless behaviors in the face of a pandemic. Thank you for listening.